Imagine taking a loved one to the hospital for surgery, trusting they'll be in safe hands, only to find the very people supposed to help are causing them pain. That's exactly what happened to Rosy Amarilis Orellana's mother at Dignity Health, California Hospital Medical Center. From a nurse who didn't understand the basics of her mom's medical history, to a painful and mishandled catheter procedure that left her mother in tears, this experience raises serious concerns. How can this be happening in our healthcare system? Stay with us as we share the full story that every patient and family member needs to hear.
My mom had surgery here yesterday. Dr. Morrissey was great and incredibly attentive, but the nurses here are terrible, and I honestly don't understand how these women are RNs. After her surgery, my mom was in the same-day surgery unit, and the nurse caring for her, named Genevieve, was awful. There was another nurse I can't remember by name, a shorter woman who looked similar to the other nurse, who was also terrible. They both kept talking in what I believe was Mandarin, so I hope that helps identify them to prevent this from happening to someone else. Neither of them knew anything about my mom's procedure. Genevieve asked me twice if my mom had a hysterectomy in the past, because she had some abdominal scars, and I had to explain both times that she'd had intestinal surgery. She wasn't paying attention to anything we told her. But the worst part was when they needed to place a Foley catheter on my mom, and they couldn't manage it without causing her pain. I was asked to leave the room while they tried, but I saw them running back and forth looking panicked. When I went to check on her, my mom was in pain and visibly upset. She asked me for help, so I complained to a male nurse on the unit. He called over the charge nurse, who placed the catheter quickly and without any issue. It didn't even take her a minute, while the other two had been poking and hurting my mom for about 10 minutes. My mom said they were stretching her legs wide and kept trying to force the catheter in, and when they couldn't get it, they just spread her legs even wider. She'd just had vaginal surgery, and they could have seriously hurt her. My mom has had surgeries before and doesn't complain easily, but these two made her cry. I work at an ER vet, and our techs treat animals with more compassion and care than these nurses did. I'm grateful that I was there to advocate for my mom, but I worry about those who come in alone and don't have anyone to speak up for them. It's terrifying that this is the state of our healthcare system. I have no complaints about the charge nurse or the male nurse. They were both helpful and kind.
Stories like this highlight just how vital it is to advocate for our loved ones in the hospital. Have you or someone you know experienced something similar? Please share your story in the comments below. Your voice matters, and together, we can shed light on the changes that need to happen in healthcare. If you found this story impactful, don't forget to hit the like button, subscribe to our channel, and ring the notification bell so you're updated on more real-life patient stories like this one. We're here to uncover the truths in healthcare, and with your support, we can reach more people and make a difference.